Before I start, I just want to say I've been called many things in these years I've been campaigning on asbestos. Shy and retiring is not one of them. Toxic radical is my favorite, and I'll put my hands up to being a toxic radical, that's for sure. I'm going to be speaking about India's asbestos time bomb. Since 1980, India's consumption of asbestos has exceeded 6 million tons. Now that 6 million tons is the exact amount used in the UK throughout the 20th century. And we all know, especially these ladies from Manchester, know the tragic outcome of the UK's love affair with asbestos. It's given us the largest epidemic of industrial disease in the history of the United Kingdom. Now, the ironic thing is that the United Kingdom is the first country to institute laws controlling hazardous exposures to asbestos. So we had these laws in 1931, and we still have this industrial epidemic. What happens in a country like India, where they use 6 million tons, and the laws that they have aren't enforced? They're worthless. Writing about her visit to Gujarat asbestos factories in 2007, Dr. Linda Waldman noted that many people are exposed to asbestos every day, and there are few attempts to control it or limit exposures. And you can see on the slide she wrote, if a victim complains, it is likely the officials from the board will take a bribe from the factory and the case will not be investigated. Even if the factory is officially closed, that happens only on paper. And basically, it's business as usual. Photographs taken would show levels of occupational exposure not experienced in Western countries in decades, reveal a pervasive disregard for the asbestos hazard in India. This photograph was taken in 2000 and is the cover of the book we did last year. It shows a gentleman sitting with his arm on a bale of asbestos, which is open. This is someone working with asbestos in 2007. And again, this is the safe use of asbestos in India. If you see those bags that have the initials LAB on them, LAB is a Canadian chrysotile company. So that's the safe use of Canadian chrysotile in India. This photograph was taken last year and is in this new India book, and you can see this is asbestos from Zimbabwe, and it's all stacked very neatly, waiting to be torn open and put into the machine. Again, you can see these gentlemen working with asbestos cement, and that big heap at the back, that's all broken asbestos cement pieces. This is the mining of asbestos in India, and there's the asbestos on the ground, all over, very, very clean, very safe processing, I don't think. And again, the sacks with asbestos on the floor. And this is the asbestos mining. These photographs, again, were taken from 2007. Do you see maybe they're invisible, maybe they're wearing invisible protective respirators and invisible clothing? I don't know, because I don't see any. And here we have the environmental exposure of asbestos. This photograph was taken in a slum and is in this book. And Caitlin, I told you about the paper about the public policy on the use of asbestos in India. And this is the center point of, this is what poor people use. These are their roofs. You can see there all the broken asbestos cement on the top. And here you have people that live near asbestos processing factories or small workshops with the children. And here you have two gentlemen, and they're cutting the asbestos cement with that little boy in the background, and the little girl surrounded by broken asbestos cement pieces. And something about this picture really gets to me, because you have the broken asbestos cement on the side, and you've got these two guys with this little boy. And it's just lovely. I mean, that's what people do with children. They play, but these people are playing right where asbestos cement is. Not really what you call an ideal living situation. How are these deadly conditions allowed to persist in a country which is one of the wealthiest economies in the developing world? What about good governance, corporate responsibility, sustainable development? What indeed? In the frantic rush for the economic development, the health of workers and the public had been a low priority for the Indian politicians, civil servants, and entrepreneurs. The acceptance of occupational and public health risks has been sanctioned at the highest level of the Indian society, as witnessed by a Supreme Court ruling made in the case of the Blue Lady ship. And this is what it said: it cannot be disputed that no development is possible without some adverse effect on the ecology and environment. Instances of industrial neglect and government complicity include the following: the non-implementation of legislation or judicial requirements, the non-enforcement of the regime for asbestos mining operations, and the long-standing practice of employers who withhold workers' medical records and test results on the ground of corporate ownership. So you're the worker, if you're lucky and your company gives you an X-ray, it's not your property. It remains the company's property, and whether they seek to tell you the results of your X-ray or not is completely down to them. India's medical community has not covered itself in glory in its treatment of patients with asbestos-related diseases. And a friend of mine did this cartoon, and I described to him my feeling about the doctors in India, and he portrayed them as magicians, because really in most circumstances the doctors in India make the disease go away because they diagnose it as TB or something else, or they don't diagnose it at all. And this friend of mine who did this cartoon made sure that the guy was smoking and had cigarettes by his side, the ashtray. So when asbestos workers in India get ill, they can't depend on the doctors. What happens? Well, they have a struggle to get their condition diagnosed, and the lucky ones overcome the difficulties in accessing medical treatment, and they overcome the discrimination they face from doctors and the religious discrimination they face, and if they're lucky, they get a diagnosis. Most of the time, that is as far as it goes. But one or two of them manage to navigate their way through the bureaucratic system and obtain compensation. Well, how much compensation do they get? If they're lucky, $4,000, and that's the one or two who are the lucky ones. It's not a lot for human life, I think you'd agree. This cartoon sums up the frustration we felt when we were writing this book, and we call it the Asbestos Olympics. And you can see that one of the workers has got a ball and chain, one of us in a wheelchair, another one is blindfolded, and they have to run the race, and they have to jump over the hurdle of diagnosis, and they jump over the hurdle of compensation. Well, I think you would admit that if you're blindfolded or if you're held back by a ball and chain on your ankle, it's not likely you're going to get over these hurdles. With a total asbestos consumption in India of 7 million tons and a population of 1 billion people, you would have thought that mesothelioma would not be unusual. However, according to Dr. Kamat, in his paper in the new book, he wrote, although mesothelioma and asbestos-related lung cancer are recognized around the world, in India, neither one of these diseases is commonly reported. This is not surprising, as in India, cancer is not a notifiable disease. According to data from regional cancer registries, in India between the years of 1993 and 1997, there were a total of 56 mesotheliomas. Now, I'm not a rocket scientist, but 56 cases over 5 years in 8 regions doesn't really sound as if we're getting the reality portrayed. Considering the widespread consumption of asbestos, the lack of regulations and enforcement, and the total absence of preventative measures, oh sorry, I forgot the invisible respirators, right. An informed individual might be forgiven for suggesting that something is not quite right with this picture. I'm going to go into my conclusion, so I think I'm going to have some money to bank for next year, some time to bank for next year. The consequences of India's haphazard and massive use of asbestos are beyond doubt. Everyone in this room knows that if you are exposed to asbestos, we know what's going to happen. It's predictable, but they're in denial. In the full knowledge of what is to come, the Indian government continues its support for the asbestos industry. campaigners and activists in India have been instrumental in the birth of grassroots programs to help these people injured by asbestos in India. And working with them, we decided to produce this book to give them the opportunity to get the literature out there, to publish in English, and to make known what was going on in India. And our collective aim in producing this book was to create a document which would contribute to the national asbestos debate in India, a publication which could be used as a resource not only for the grassroots campaigners, but also for those people working to expose the errors and lies that are at the heart of India's new chrysotile studies. And Dr. Richard Lemon, whose paper is a crucial part of this monograph, does not mince his words when he describes the Indian government's chrysotile studies as smoke and mirrors, illusion and confusion, but not fact. Just a few weeks ago, at a location not very far from here, Slumdog Millionaire won many Oscars. When you view this film through the asbestos filter, which many of us have, we notice the asbestos cement roofs that the characters run over in these scenes, in some of the scenes. And this is what they look like. This is a picture that's in our book, and you can see these roofs throughout the Mumbai slums in Slumdog Millionaire and throughout many other Indian cities. Even as representatives of the Indian government collude with industry stakeholders to deny the hazardous nature of asbestos, exposures are occurring which will result in deaths on an unprecedented scale in the future. Working with our colleagues in India and elsewhere, IBAS is determined to bring an end to this industry of mass destruction. I hope that you will you will come with us. The ADAO will be with us all the way on this journey, and together we will campaign for a global ban on asbestos to save the future generations.